Hi Equals, it's Kim. So we're continuing our talk about young people, and we were talking about earlier this week about non-affirming families, non-affirming schools. And one of the outcomes, or one of the, I guess not outcome, but one of the things that happens when a young person is either outed to non-affirming parents or comes out to non-affirming parents is that the parents, part of their first reaction is often, I need to fix this. I've heard stories about it, about their reaction being about, I don't want to be embarrassed in my community. I don't want to be thrown out of my church. We can talk about church's role in all of this at some point too. They may, feel like their friends are going to think less of them if they have an LGBT child. There can be all kinds of reasons. A lot of it's around shame. And I'm getting on a roll here with this whole issue of shame and just the damage that it does when we rely on it as a way to change people's behaviors. All right, so notice I said the word behavior. So sexual orientation and gender identity are not things you can change because they're not behaviors. They're identity. They're core pieces of a person. For example, if you're a straight cisgender person, I'll put up the LGBTQ video, but if you're a straight cisgender person, you probably haven't had to think about this a whole lot. It is that knowledge of yourself as being male or female, and it's the knowledge of yourself as being attracted to the opposite sex. It probably occurred to you sometime around puberty, and you didn't have to think about it much because it fell into line. What you understood about yourself fell into line with societal expectations. Part of the issue for LGBT kids is that as they get into puberty, etc., or whenever it happens, their understanding of themselves, this core part of themselves, doesn't match with society's expectation, and they don't know what to do with it, especially if they feel alone in the world, that they're the only one who's ever experienced this, that they don't feel like they can talk to their parents or their teachers or anybody in their lives about what's going on, can cause issues. Whether they're mental health issues or just psycho-emotional issues, that disconnect, that understanding of self as being different than other people in your intimate circle. When a non-affirming parent or school uses shame or variations on shame to change the behavior of a child, they might be able to affect the behavior of a child for a time frame, right? And it might be the time frame between now and when that child turns 18 and can go off to college or whatever and be themselves. Or it could be between now and when the child decides they can't take it any longer and they run away. And we've talked about what happens when you have a child who is out on their own. They get involved in various state systems which are not overly affirming themselves, and it just perpetuates this problem. But one of the options that parents often look for is therapy. They want to cure their child. You can't cure sexual orientation and gender identity. Those are core pieces of an individual. Yes, you can coerce behavior to change, but you can't cure anyone. And licensed professionals in psychology, psychiatry, counselors, marriage and family therapists, social workers, all know this. Right? So let's first talk about those licensed therapists. They know that it is against their code of ethics to impose their beliefs on what therapy a child should have. It's also against their standards of care to come into a situation with a preconceived idea of what the outcome is. Therapy should be about what the client, the patient, wants. Conflict we get into is when that client or patient is a minor and whose parents are driving what they want the outcome of the therapy to be. They want a cured child. They're going to go looking for a conversion therapist. Now, it is against the ethics and the standards of care of state licensed therapists to engage in conversion therapy. What is conversion therapy? Well, conversion therapy is clearly efforts to cure, statements saying, I can cure your child of their homosexuality or their gender identity, although we're probably going to use some bad term like transgenderism or something like that. Do not use that word. Right, but that's one of your cues that you're looking at a conversion therapist if they use that language. Anyway, they may say they can cure someone, or they're going to go, another Q word. I'm a person of faith. I hate that this is true, but biblical standards of sexuality, biblical standards of gender, another code word for we're going to insist on somebody living up to an imposed standard rather than being their authentic true self. Force a child to be something other than what they are. No matter what the situation is, the outcome is often poor. Not a counselor. Go listen to counselors talk about the trauma, etc., that is caused by that. But conversion therapy, the idea that you can cure somebody or rid them, they often use this phrase of unwanted same-sex attraction. Yeah, that's another code word. That they can do that is first not scientifically supported by studies. Now, they'll point to, all these ex-gay ministries that have had successes in the past. Well, if you really look into the history of that, you'll find that a lot of the most famous cases of ex-gay ministry being successful, years later, the person turns around and says, it wasn't successful. It never changed my core identity, and I couldn't live a lie any longer, and they come back out again as LGBT. And we've seen this now over time, this pattern repeat. Now, are there occasionally what looks like a success? Possibly. But let me put out there a supposition. What if those situations where we consider them successes, the person was bisexual to start with, right? Not every young person growing up, even young adult, understands all of the things that maybe I do or people who are, like me are in the movement. But LGBT includes bisexual. And if you're growing up and you're a young person and you find yourself attracted to the same sex, you might all of a sudden think, oh no, I'm gay. When the truth might be that you're actually either attracted to both men and women, or you're attracted to all genders. So this could be all forms of gender nonconformity. So those successes in conversion therapy may have been people who were actually bisexual. And what they simply do in life is limit their dating pool. All right, while they're attracted to both men and women, they're only going to date people of the opposite sex because they're trying to live up to either their own religious values or their family's religious values or their church's religious values or whatever else. They just simply limit their dating pool. That's great. That's fine. But it doesn't work for everyone because not everyone is bisexual. There are people who go into therapy and they're looking for help to live a celibate life. If they're adults and they want to do this, more power to them. I couldn't, and not everybody can. But if they want to, and they want, help from a licensed professional to figure out how to live a celibate life, where they're not trying to be cured, and the therapist is being neutral about their sexual orientation or gender identity, that's fine. Also, sometimes the word conversion in conversion therapy, it's also called sexual orientation change efforts, reparative therapy, ex-gay therapy, those kinds of things. It gets some confusion around gender identity because some people who are transgender both socially and physically transition. So let's talk about them here. Socially transition is you change your name, you change the gender markers on your identity papers. You go through life as the gender that you feel yourself to be socially and in the world, but you don't actually engage in any physical transformation. Some people simply take hormones, HRT, hormone replacement therapy. It's the same therapy that, women who are menopausal will take extra estrogen. It's the same kind of concept, or people whose testosterone levels are low, they'll take extra testosterone. It's the same kind of concept, but just for a different reason. Occasionally you'll hear about non-branded medications or hormones we often use drugs for purposes other than what they were originally intended for. All kinds of drugs, that were, I'm pretty sure that even the little blue pill, was originally designed for something else, and then they found it worked, as the little blue pill. Look it up if you don't know what I'm talking about. But anyway, so there's nothing wrong with that. Under a doctor's care, there's nothing actually wrong with a medication designed for one thing to be used in a different situation where it is effective. Because transgender people transition, some people might use convert from male to female as a word, if not out loud, maybe in their heads. And so then they get confused about conversion therapy and thinking that if we're going to ban conversion therapy, that we're banning therapy that would help transgender people transition. And no, that is not it. There's actually an official definition that we use around conversion therapy. When we're talking about laws or policies that talk about why licensed professionals, actually I think anyone, but for the most part the state of Ohio can only limit the professionals that they license. So this wouldn't be like Christian lay people, etc. They are not covered by something that the state would do. Remember, there is this First Amendment right, and we can't limit that. But let me read to you some of the things about that might clarify what conversion therapy is and is not. All right. So licensees should practice their professions by relying upon the best research and clinical evidence available. Licensees use evidence-based and well-established counseling techniques designed to assist clients in reconciling conflicting identities, including those related to faith traditions and sexual orientation and gender identity. These include efforts that provide accurate information, encourage identity exploration and integration, so becoming a whole person, adaptive coping to improve psychological well-being, and avoid efforts to change sexual orientation and gender identity. Those kinds of therapies that help somebody explore their identity and integrate their identity, and this would include people who are transgender, is not covered under a ban of conversion therapy. It's considered still good therapy. Right? I happen to know, because I talk to social workers, that there are affirming therapies. One of the things that I've also learned is that professional licensed therapists, should meet a client where the client is. So if the client's in a negative space around their sexual orientation or gender identity, the therapist isn't going to walk in and go, "Oh, you're wrong. You should be proud that you're LGBT." They're going to meet the person where they are and move them through that integration and psychological well-being without imposing their own belief, positive or negative, on the client. It's about what the client wants and about integrating that person as a whole person and their psychological well-being. All right, enough about conversion therapy right now. It is legal in Ohio. It is, however, pretty universally understood to be against standards of care and the ethics of licensed psychiatrists, psychologists, social workers, counselors, and marriage and family therapists. Have a good weekend, everybody. If you like this video, give me a thumbs up, hit the red subscribe button, hit the bell so that you will get notified every time I put up a new video. I do 2 a week. Not very consistently as to which days I put them up, but I do generally do 2 a week. Again, have a good weekend. Bye, equals.